Joining us for Oregon Medicaid EHR Incentive Programs Program Year 2019 webinar. This webinar is presented by Janae Sheridan, Joni Moore, Jesse Wilson, and Kate Lonboard. Our agenda for this webinar will be quick reminders for the newest program year. We will touch on some of the more complex objectives and program year changes. We will go over our required documentation list and have a refresher on the Clinical Quality Metrics Registry. At the end of this webinar, we will provide for you some program resources as well. Reminders. The attestation period is going to be January 1st, 2020 through March 31st of 2020. Be advised that there will be no extensions. This March 31st date is firm. As always, you will not be able to attest for your 2019 program year until your 2018 attestation is processed and paid. If you are audited, please remember to retain all your documentation regarding patient volume, objective and measure exclusions, unique patient counts, and your security risk analysis. For the program year 2019, for the EHR reporting period, we'll be looking for a 90-day period between January 1st and December 31st of 2019. All meaningful use attestations will be in stage 3 only. You will need to have 2015 edition certified EHR. This will need to be in place by the beginning of the EHR period and will need to be certified by the end of your EHR period. For your clinical quality metrics, we will be expecting a full year of CQMs, and you need only report on 6 relevant CQMs out of the 50 available.
We're going to go over stage 3 highlights, objectives without changes. Objective 1 has to do with the SRA, protect patient health information. You would need to conduct or review a security risk analysis during calendar year 2019. It must be done also upon installation or upgrade to a new system, the 2015 cert. So if you did your SRA at the beginning of calendar year 2019 and you don't get your upgrade to the 2015 cert, then you would need until October, then you would need to do a new SRA after the 2015 cert has been installed. There is no exclusion available on this one. It must be completed in order to meet meaningful use. Objective 3 is the clinical decision support rule. You must answer both. Implement 5 clinical decision support interventions and also implement the drug-to-drug and drug allergy interaction checks. The next thing we're going to cover is stage 3 highlights, objectives with changes. Objective 2, the difference in this one is the electronic prescribing. You must meet the threshold or qualify for the exclusion criteria. And the exclusion criteria is on the specification sheets at the CMS site. That more than 60% of all permissible prescriptions written by the EP are queried for a drug formulary and transmitted electronically using your cert. And then objective 4 is the CPOE, the computerized provider and order entry. You must satisfy all 3 measures through a combination of meeting the thresholds and or exclusions. Measure 1 stays the same at 60% of medication orders are ordered using CPOE. Measure 2 is more than 60% of lab orders are ordered using CPOE, which is an increase from 30%. Measure 3 is also an increase from 30% for radiology orders. Objective 5 is the patient electronic access to health information. EPs must satisfy both measures for this objective through a combination of meeting the thresholds and/or exclusions. Measure 1 is more than 80% of all unique patients are provided online access, and this also includes where it needs to be accessible via an application programming interface API. That is something new for program year 2019 stage 3. Measure 2 is more than 35% of the unique patients are provided with educational resources, must be identified by the CERT, and it cannot be provided in paper format, and that is an increase from the 10% in previous years. Objective 6 is the coordination of care through patient engagement. EPs must attest to all 3 measures and must meet the thresholds for 2 of the 3 measures. If the EP cannot meet the threshold for 2 measures, they must meet the exclusion criteria for remaining measures. So measure 1, more than 5% of all unique patients view, download, or transmit their health information, access it through an API, or a combination of those 2. Measure 2 is more than 5% of all unique patients are sent a secure message. And this is for provider-to-provider communication, as long as the patient or their authorized representative is included in that message, or if a patient sends their provider a message with PHI in it and the provider responds, or a provider sends something PHI to the patient. Objective 6 continued. In measure 3 is more than 5% of all unique patients incorporate non-clinical data into the CERT. Now, non-clinical data can include anything but is not limited to social service data, data generated by a patient or a patient's authorized representative, advanced directives, medical device data, home health monitoring data, and fitness monitoring data. So anything like that that the patient or their authorized representative would add to their information. Objective 7 is the health information exchange. EPs must attest again to all 3 measures and must meet the threshold for 2 measures. If the EP cannot meet the threshold for 2 measures, they must meet the exclusion criteria for remaining measures. Measure 1 is more than 50% receive electronic summaries are transmitted for a transition of care to another provider. Measure 2 is more than 40% of electronic summaries are incorporated for new patients. So that's patients that this provider has never seen. And then measure 3 is more than 80% reconciliation for at least 2 clinical information sets: medication, medication allergy, and current problem list is performed for new patients. Now, if you meet 2 of those measures and you don't meet the 3rd, then you've met the objective. If you only meet 1 of the measures and take an exclusion and you don't meet the 3rd measure, then you don't meet that objective, and we can go over that further in another slide. And this is continuing with objectives 6 and 7. If the EP meets the criteria for the exclusion from 2 measures, they must meet the threshold for the 1 remaining measure. If the EP meets the criteria for exclusion from only 1 measure, they must meet the threshold for the remaining 2 measures. So for example, for objective 6, if they meet measure 1 at 6% and they meet measure 2 at 10%, but they don't meet measure 3 because they don't have the 5%, then they meet that objective because they've met the threshold for 2 of the 3. The other example is Objective 7. They can exclude Measure 1 because they have less than 100 encounters. They meet the threshold for Measure 2, and Measure 3 is the 80% threshold, and they only have 70%. Then they would not meet the objective for that, and so they would not meet meaningful use.
Now we'd like to talk about some Stage 3 changes with Objective 8, which is Public Health and Clinical Data Registry Reporting. So now for 2019 Stage 3, the EP must satisfy 2 of the 5 measures or take exclusions from all measures they cannot meet. So this is different from Modified Stage 2 when there were only 3 measures. There are now 5. Measure 1, immunization registry reporting, that's still the same except for now there is a bidirectional requirement. Measure 2, syndromic surveillance reporting, that is still only available to urgent care providers in Oregon. Measure 3, electronic case reporting, this is now its own measure. It used to be part of the specialized registry reporting in Modified Stage 2, but it is now its own measure. Measure 4, public health registry reporting, and Measure 5, this is a new one for Stage 3, clinical data registry reporting. So note, if you only meet one of these measures and you qualify for exclusions, you will need to answer all 5 of the measures in MAPR. Okay, so this table here shows you how you can meet the 2 measures. You can use a variety of combinations. You can report immunization registry reporting once, and then syndromic surveillance reporting, that can count once towards meeting the objective. Electronic case reporting counts once. Public health registry reporting, you can count 2 different public health registries, and you can count that twice, so then that would meet the objective. So if you, for example, report or run a query in 2019 for PDMP, prescription drug monitoring program, and you also send data to the the communicable disease registry, those 2 would then count towards meeting the objective. So you wouldn't need to report to a different registry. Measure 5, that can count twice as well if you have 2 different CDRs that you report to. That would help you meet the measure or the objective as well. Okay, so what you need to know about taking exclusions on Objective 8, Measure 4, and 5. So there is some due diligence that needs to be conducted by the EP, just as in previous years. You would want to first check the available Oregon Public Health registries to see if there are any that you would qualify for. If not, then you could take the exclusion. You would also want to check your specialty society or any affiliations to see if there's a registry ready to receive electronic public health data. So if you are unable to find any that is ready to receive the data, or that you really don't have in your scope of practice the need to report to, then you could qualify for the exclusion from Objective 8. But if you do determine that no registries are available, please note that you may be requested supporting documentation from EHR Incentive Program staff. And so just a reminder, here are the available Oregon Public Health registries that have declared readiness, and you can access these through the link that was in one of the previous slides. We have blood-lead reporting, communicable disease reporting, electronic case reporting, and prescription drug monitoring program. Okay, now we're going to go over the required documentation that you'll need to submit with your 2019 attestation. So the first thing you'll want to have is that 2015 Certified EHR Technology documentation. So that's the document that shows that you have upgraded to a 2015 cert. And on that, we'll be looking for the organization or clinic name, as well as the date that you upgraded to the 2015 cert. Additionally, as usual with previous program years, we'll be looking for the EHR scorecard or dashboard for your objectives and measures. So that's the report that you get from your system showing that you've met the thresholds for the different meaningful use objectives and measures. We'll also be looking for your security risk assessment or security risk analysis for program year 2019. So again, that needs to be conducted or reviewed in calendar year 2019, and it does need to cover or include the upgrade or implementation of your 2015 cert. So if you, something to consider, if you've already done your 2019 security risk assessment, but you still haven't completed your upgrade to your 2015 cert, you will need to conduct a new SRA or security risk assessment to cover the upgrade to your 2015 cert. That does need to be included in your SRA. Another thing we'll be looking for is your ECQM report. So again, you're submitting your ECQMs via the Clinical Quality Metrics Registry, or CQMR, and there are two ways that you can submit that data. It's the Excel template, or you can submit via QRDA. If you use the Excel template to report those measures, you will also need to upload the report of your ECQMs from your EHR into Mapper. Okay, additionally, for Objective 8, I just wanted to go through the supporting documentation that we're looking for there because it's not always the same for each measure. So for Measure 1, if you're reporting to the Immunization Registry, we actually don't need you to provide us with any documentation. We will, the Medicaid EHR Incentive Program staff, or MERIP staff, will obtain the documentation we need directly from Public Health. For Measure 2, syndromic surveillance reporting, again, that would be a rare instance, but if we do have a provider attesting to that, we will obtain the documentation from Public Health for you. Measure 3, if you're going to report or attest to electronic case reporting, you would need to supply us with a current letter from Public Health showing what phase of active engagement that you are in. And then you would also need to supply us with an Excel document with all the providers from your clinic or your organization who are attesting and using the electronic case reporting. Measure 4, Public Health Registry reporting. Again, you would need to supply us with a letter from Public Health and the Excel document with your providers' names and NPIs. This is very similar to what we've done in the past. The only exception would be the prescription drug monitoring program. We don't need a letter or Excel spreadsheet from you. A screenshot would suffice. So if your provider or their delegate can obtain a screenshot showing that 90 days prior to the EHR reporting period or during the EHR reporting period, they accessed the PDMP, then that would suffice as the documentation. Measure 5, clinical data registry reporting, you would need to supply us with the letter from the CDR as well as that Excel document. So again, the Excel document is something that you create. That's not something that you get from your registry. They're only providing you with a letter verifying what option of active engagement you are in. Those of you that attested in program year 2018 probably recall the Clinical Quality Metrics Registry, since that was a change for program year 2018. But we wanted to do a little refresher on what that is, since it'll be used moving forward as well for additional program years. So the CQMR is the new reporting tool for EHR-sourced quality measures. It's where we collect the ECQMs specified for the CMS programs per national standards, and it collects aggregated data for the state-specific CCO measures as well. And so really what this tool does is it consolidates the ECQM reporting across the various programs, such as the Medicaid EHR Incentive Program, CCO incentive measures, CPC Plus, Merit-Based Incentive Payment System, or MIPS as well, and possibly additional programs over time. That's to be determined. And then the vendors that we work with for this program, or this tool, are Velatura, also known as MyHIN, as well as One HealthPort for the single sign-on service.
And let's talk a little bit about how the CQMR is used for the Medicaid EHR Incentive Program. So ECQM reporting is now done in the CQMR rather than in MAPR, although MAPR is still used for most of the components of your attestation, like your patient volume and your meaningful use objectives. And you can do the work in MAPR and the CQMR in any order. You just will be doing your ECQMs in the CQMR. If you didn't attest in 2018 and you haven't yet onboarded to the CQMR, you'll find in our program, in the slides, links to the CQMR onboarding page that will walk you through the process to onboard to the CQMR. You'll also find training materials there, and we will be updating those training materials to add more information. So please visit our website to get that information. I also wanted to highlight a few updates for you for 2019 reporting in the CQMR. So the CQMR will continue to support options to submit your ECQMs in either QRDA3 or using the Excel template. We will be adding an option for consolidating QRDA3 files for eligible professionals who practice in multiple locations. We found in 2018 that we had challenges for some EPs who practice in more than one location and they have multiple QRDA3 files. And the expectation from CMS is to have a single file for each provider. So we're working with our vendor to support an option where you could upload your QRDA3 files for each EP, and the system would consolidate those into one file, so you wouldn't have to use the Excel template if you had QRDA3 files available for your EPs. We also will be updating the Excel template for 2019 to reflect changes in the CMS ECQM measure set. And then we also wanted to highlight for you that we'll be offering an additional training webinar. We anticipate scheduling that for the late fall or early winter to help you get ready for 2019 reporting. And we'll get more information out about that. And we also plan to record that and post that to our webpage. We also did want to highlight again that the CQMR is available to send ECQMs to CMS for MIPS and for CPC Plus if you participate in those programs. And if you're interested in a little more information about how the reporting parameters for those different programs compare, you'll find a link there that kind of walks through the requirements for reporting for each of those programs. Lastly, I wanted to highlight a few resources for you. On the CQMR webpage, you'll find onboarding information and training materials. As I said before, we're going to be updating the materials and adding new materials. You also are welcome to email us with questions. If you have questions about the CQMR specifically, please contact us at oregon.cqmr@dhsoha.state.or.us. The Medicaid EHR Incentive Program, of course, you're very familiar with that email address. So for program questions about the EHR Incentive Program, that's the place to contact you or to contact us. And we also would encourage you to give us feedback. We have a SurveyMonkey out to collect feedback, and that will be open through Friday the 16th.
And in this slide, you'll see our program resources. These are the links to the sites that you will probably frequently need to access. So we've got the top one there, the Oregon Medicaid EHR Incentive Program. That is our specific website. You can find tips and links to other important sites, as well as the specification sheets, any alerts or updates that we have regarding program year 2019. We also have the Stage 3 for eligible professional specification sheets linked there as well if you want to go directly to those. And then the MAPR, that is the attestation web portal. So if you need to access the web portal at any time, that would be the link. You would want to save that to your favorites. And then the last link there is for the Oregon Public Health Registry. So that's what we went over previously in this presentation for the different registries that you have available to you in Oregon for public health. If you need to contact us, here's our direct phone line here, as well as our email address. And then again, our website if you have any questions about the program or program year 2019. If you have questions related to a post-payment audit, please contact Jenny Claiborne, who is our Medicaid EHR Incentive Program auditor, and her email is below.
Again, I want to thank you for joining us today. Because this webinar actually already took place, we will be uploading the questions and the answers to our website in a PDF document. But please do not hesitate to reach out to us if you have any additional questions. Thank you.